in collaboration with LMC Healthcare. We are so glad to have you join us for this wonderful learning opportunity. To briefly introduce ourselves, IDNC is an organization of internationally trained dietitians, registered dietitians, dietetic students in Canada and abroad, as well as many other individuals in the field of dietetics. Our goal is to educate, enhance, embrace, and encourage you all throughout your dietetics journey, whether it is taking place in Canada, India, or anywhere else in the world. Moving on, LMC Healthcare, who we are collaborating with today, is Canada's largest specialist care provider in diabetes and endocrinology. They have a diverse interdisciplinary team of many different healthcare professionals and are renowned for their expertise. As diabetes prevalence is increasing drastically around the world, it's crucial that us healthcare professionals continue to learn more and more about the various aspects of diabetes, as well as such that we are able to provide the best and most up-to-date healthcare services possible. To introduce Arpita Khalsa, she is a registered dietitian and certified diabetes educator in Canada, and she will be hosting a webinar today and will be educating us all about diabetes. We ask that throughout the webinar, you guys all stay mute. We will have a question and answer session at the end of the webinar where you can she will be answering all her questions, and you can leave all your questions in the chat box and we will get to them throughout the webinar. Feel free to, again, leave questions in the chat box, and we ask that you kindly stay muted throughout the presentation. We'll pass on the spotlight to Arpita Khalsa now.
Great, thank you for the elaborate introduction, Noor. Good morning, everyone. Good morning in Canada and good evening in India and rest of the world. My name is Arpita. I'm one of the diabetes educators. I'm a registered dietitian. I'm just going to share my screen so you can see it. Please let me know if you can see it. Give me a thumbs up if you can see it, or type in the chat box if everybody can see. Okay, that's amazing. So today's session is going to be focused on glucose monitoring devices. As we know that diabetes is one of the biggest global pandemics. We want to make sure that we have the right knowledge and the tools that we need to be able to educate our patients. So this session will focus on blood glucose monitoring devices. A little bit about me. As you know, I'm a registered dietitian, certified diabetes educator, but I'm also a certified insulin pump trainer. I immigrated to Canada in 2011, and I completed IDPP, which is Internationally Educated Dietitians Pre-Registration Program, in 2013-2014. And in my work with LMC, I work with people living with type 1 diabetes, type 2 diabetes, pre-diabetes, and gestational diabetes. So the agenda for today's session is to understand why do we need to self-monitor blood sugars. SMBG stands for self-monitoring of blood glucose. We'll also talk about different methods for checking blood sugars. Some of them are blood sugar meter, using blood sugar meter, and sensor glucose monitoring. We'll also talk about how is sensor glucose different from blood sugar, and we'll talk more about FGM, which is flash glucose monitoring, and CGM, which is continuous glucose monitoring, and provincial coverage for people who live in Ontario, and suggested resources, and we'll have some takeaway messages. Okay. So first, let's discuss why do we need to check the blood sugars? So if you can all respond in the chat box with your answer, that would be great. Like why, when we tell our patients that, okay, check your blood sugars and, bring them to me, but then why do they need to do it? What's the purpose of it? There are like 17 people here. I'm sure you have one reason to tell your patients about checking the blood sugars. So generally, so to get an estimate of the sugar levels, that's great, Hershey. Yep, that's one of the biggest reason why we tell them to check the blood sugars, just to see how the glycemic control is. Anybody else wants to answer? Okay, so I'm gonna continue, and feel free to type in, your answers if you if you need to. Again, like I want to make sure that you're getting the best out of this presentation. So as Harsheen mentioned, that to check the glycemic control and sugar. Oh, we got one more response. Oh, we got two more. Yeah. To see trends of the blood sugar, that's amazing. Yeah, to check if the suggested regimen is working for them and they're following it properly. That is amazing. Yes, Tuba. So generally, SMBG, which is self-monitoring of blood glucose, is an integral part of diabetes management. That's the only way we know how things are going, how the blood sugar management is going. It also helps to understand the patient or the client in understanding whether they have like hypo or hyperglycemia at a given time. Like for example, I have a client who lives with type 1 diabetes, and every Tuesday mornings she will have high blood sugar. Like Tuesday is a day where she's having high blood sugar all day, and sugars are beautiful over the weekend. So I asked her, I'm like, hey, like what's happening? Like how is your sugar high on the weekday, like on a Tuesday, and how is it not high on the other days? And she tells me like weekends she goes away from her family, away from her kids in a cottage, and then Tuesdays is when she comes back to her family. So like stress induced high sugars can also if she wouldn't keep that record, I would not know that okay, this is a lifestyle factor that's happening and it's impacting her blood sugar. So it can help to understand the client also better as to whether they have low blood sugars or high blood sugars at a given time. It helps us to determine glycemic patterns. If there's any pattern, we can help them in making any treatment decisions. So for example, if somebody is taking insulin and they have high blood sugar, let's say before lunchtime, we can always help them troubleshoot as to what's going well and what's contributing to this high sugar, and how can we alter the regimen. And also it helps us to provide, as diabetes providers, it helps us to provide to determine whether the current regimen that they're on is working or not. And we always need to tweak things here and there, and that's okay. Generally, Diabetes Canada says that if a regimen is started, generally the goal is to bring the A1C down in 6 months. So if it's not coming down in 6 months, that means something's not going right, and we need to alter the regimen, and just to make sure that the patient is supported in the best possible way. And bottom line is SMBG is the only way to know the blood sugar level. Like I cannot sit here and be like, oh, I think my blood sugar is 5.8. Oh, maybe I'm at 16. Like I don't know unless I check. And that's why SMBG is a very, very critical tool in somebody's journey for diabetes management. Okay. So there are various ways for checking the blood sugars. So there are blood glucose monitoring devices which check the blood with the capillary in the capillary. And then there are also sensor glucose monitoring devices. And the sensor glucose monitoring devices are two types. One is called flash glucose monitoring. So you flash the reader, such as Freestyle Libre. You flash the reader on the sensor, and the sensor is going to and the reader is going to show you the reading. But we will see that device. And there's a continuous glucose monitor, such as Dexcom and Medtronic CGM. So there are like two types of devices. We will talk about that as well. So blood glucose monitoring devices, as the name suggests, it's monitoring the blood sugar using the blood. So it requires a finger prick. So it's checking the blood with the capillary. And in Canada, there are various brands available, such as AccuCheck Guide, and some of them they have different features. We'll see what kind of different features are in each one, not in each one of them, but how they are different from one another. Contour Next One or Contour Next. Previously, Essentia was called Bayer. So that's you also get this meter in India. One Touch Reveal, which is made by Johnson & Johnson, and Freestyle Light, which is made by Abbott Canada. And Abbott Canada also makes Freestyle Libre, which is the flash glucose monitoring device. So they all are similar in the way because they all use a lancing device, which is the pen that we used to poke the finger with. They all use lancet. Lancet is a needle. They all use glucometer strips, and every strip is different. Another common thing is the strips are light sensitive. So the enzymes in the strip which check the blood sugar are light sensitive. So we have to make sure that the strips are actually So we have to make sure that the strips are not exposed to light for a long period of time, and the lid should always be closed. And strips also have an expiry. This is very, very common because a lot of people do not know that strips have an expiry date. And all the reader, all the glucometer devices will display the most current blood sugar reading, like what my sugar is right now. So these are the similarities of all the glucometers, but how are they different? So all of them are different from each other in terms of the accuracy. So MARD is the way, which is mean average relative difference. So basically, it's comparing the blood sugar the blood sugar reading from the meter with the lab reading. So generally, Canadian standards are to keep it within 15% of the lab results. So when you're telling your patients, and this is supposed to be done once in a year, so make sure to educate your patients about this, that you want to check if your meter is reading accurately or not. So you want to go, whenever you go to the lab once in a year, get your blood work done, and within 5 minutes of them taking your blood, check your sugar within 5 minutes and write down that number. When you go to your family doctor, when you go to endocrinologist, ask them what the sugar reading is. So the comparison between the lab and your blood sugar meter should not be more than 15% difference. It can be 15% plus, 15% minus, but it should not be over 15%. And if it's over 15% of the accuracy, that means that the meter is not accurate, it's not reading well. And this can be very important for people who take insulin and for people whose dosages are dependent on that blood sugar reading. So they may underdose or overdose based on the sugar reading that the meter is giving them. They also, some of the meters also have a smart light. So Bayer Contour has a smart light at the bottom. So basically this is Bayer meter, Contour next one. So whenever you put the strip in with the blood sugar reading, it's gonna turn yellow, which shows high sugar reading. It shows green, which shows reading in normal range. And it also turns red. So there are different ways of showing that, the sugar. It's easy for patient to also know whether my sugar is like high, low, or within range. Some of them also have a strip ejector. So Contour Next, not Contour, AccuCheck Guide has a strip ejector. So basically, it has a button that you press and you put that in the sharps container, and you don't have to touch the strip at all. And strips can go in garbage. It's just a lancet that needs to go in the sharps container because it's a biohazard. Other features are some of the meters have Bluetooth technology. So they're sending they're sending the information from the glucometer onto the app. So some apps are called, so Contour Next has an app which is called Contour Next One. Also, from One Touch Reveal has an app which is One Touch Reveal. One Touch Reveal also has a website. So the care provider, so like yourself, for example, you can have a clinic ID. You can, in your company, you can tell them to have a clinic ID, and that's a clinic ID that you share with your patient, and you tell the patient to share that, authorize that that clinic to share the information with. So whenever you're seeing the patient, and whenever the patient is checking the blood sugar, it's going to go on the phone, and ultimately it's also going to come to your LMC, not your LMC, but your Reveal website, One Touch Reveal website, and you can see the readings, and it helps you to make better decisions about their treatment regimen. A lot of them are also easy to use. So some, like I have a client who's legally blind, and all the glucometers, a lot of them don't have ability to read the number to them. So there's a glucometer that's available, which helps them to, which is called Oracle. It's made by a company called Oracle, and then when you put the strip in, it's going to read out the reading to them. So that's how they know, okay, whether they need to, the sugars are going high or sugars are going low. And that particular client of mine who's blind, like she listen to the clicks, like tick 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 for the insulin, and that's how she will do. So one click is 1 unit. So that's how she's going to do. So for somebody like that who's legally blind, who lives alone, I think it's important to make sure that they have glucometer that they need. And that's why it's important for us as healthcare providers to be aware about the different types of glucometers that are available in the market, and what are the common features, what are different features. And some of the meters also have second chance sampling. So for example, Bayer Contour will have second chance sampling. So for example, if your patient, or even Freestyle Light will have a second chance sampling. So if, for example, if your patient, strips are the most expensive part in the glucometer. Strip is $1 per strip. So second chance sampling allows the patient to put more blood on the strip without wasting the strip if the meter gives an error saying inadequate blood. So it's important to make sure that US healthcare providers also know which meters have that ability. And it also helps the patients to it also helps the patients with dexterity issues, like if somebody has, if somebody's an elderly, they have Parkinson's, like they have shaky hands, like any meter that's easy for them to use needs to be given to them. So let's see how to use a glucometer. So I got Contour Next one from my clinic because this is the most popular one, and this one is most accurate one. Again, I'm not supposed to, I'm not endorsing any brand, but this is the one that we most commonly use in the clinic. There's AccuCheck Guide, which is also great. So this one is, that's Contour Next one. So when you open the package, it has a glucometer. As you can see, it's beautiful, and a lot of them don't have batteries too. So you have to make sure, that you're checking it when you're educating the patients. Important to tell them, like, okay, this is how you charge it, or the thing will die on you, or if it needs a battery change, make sure you're changing the battery. Even educating patients about small things like changing the time. So in Canada, we have daylight savings during winter time, and we also have spring forward during springtime. So it's important to tell the patients that, make sure, that you are, that you're changing the time, because that whole thing can mess up with with their regimen, if anything. So this one has a USB, so it uses micro USB. A lot of them will use micro USB. And also it's important to tell your patients that there's a customer care number at the back. All the meters have a customer care number at the back. So in case they're stuck, they don't know where to call, this is where they call. It also comes with a warranty card. Make sure you tell your patients to fill it out, because all the warranty cards, go to the company, and if there's a recall regarding the meter, they will get notified. Nobody reads these big books, but but it's good to keep them in case just to understand the errors. But a few things that I really like are these quick guides. So this one is in French. Oh, this part is in English. So this one will help them set up the glucometer easily, because we all want quick stuff. Nobody wants to read pages and pages. So all these things will also guide them about how to check the sugars and date, and how to change the date and stuff like that. That's a logbook. This will help you to determine how the blood sugar control is. So make sure you tell the patients to write down the numbers, and there are apps that they can use as well. So this one is a big one. So that's a lancing device. So let's take this one out, because this is very important thing. So all the lancing devices have these numbers, which is 1, they go up to 5. So these numbers will tell us how deep is the lancet supposed to go. And the more deep the lancet goes, more pain is it going to cause. Actually, less pain it's going to cause. So the more deep it goes, less pain it causes. It's actually opposite. And also the needles, so the lancets, it's got to use my strength. So in terms of the lancets or any needles, if you're using even for injections, higher the gauge size, finer the needle is. So just like additional information. So this is a lancet that goes with it. So this particular device has ridges. So you hold on to the ridges, and then you twist it and open it. All the lancing devices are going to be different. Put the needle in. So that's remove the cap and then put the needle on. And also important thing to make sure is before checking the blood sugar, it's important for the patient to wash their hands thoroughly, because if they've eaten something and something's on their hand, the strip may pick it up, and that can cause a little bit of an issue there, and it can cause an error in the blood sugar reading. So, this is the number, how deep you want it to go. always also make sure, I'm not going to prick myself, but always make sure you're telling your patients to always prick on the sides. Like the sides is a good side to prick, because in the middle, the nerves are more concentrated, so it hurts more. And ask your patients if they have hot water available or warm water available. Make sure you wash your hands with warm water just to get the blood circulation going. Okay. And then you prick the blood sugar. And also a lot of us have a habit of like drawing the blood like this. Don't draw like this, draw like this, because the blood is going to come down through gravity. And then you put the blood on the strip. So there's a strip that goes in, and it'll suck it up. And a lot of the glucometers use microliters of blood. So it's very, very little blood. And if you have a patient who's having issues with drawing the blood, like some strategies that you can use is make sure that that the needle is set at a higher number, so it's going to go more deep, so it's going to be pricking them nicely. Another thing that they do is, if the hands are cold, they need to like rub their hands to make it warm, so it can get the blood circulation going. And also, a lot of people are scared of needles. So make sure you tell, it's important to normalize it. It's important to normalize checking the blood sugars, and important to tell the patients, because patients will do things that are important to them, right? So making sure, we're telling the patients about why they need to check the blood sugar. And also a lot of the people that we work with have a habit of checking like only fasting, because oh yeah, it's going to go high after the food anyways. But how high is it going? It's important to know, right? So I usually tell them, like, if you're giving me only fasting readings, it's like this. I don't see anything else that's happening around. Like, I don't see what's happening throughout the day. So if you want to check the blood sugar one time, it's okay, no big deal. But just make sure you're checking it at different times during the day. So one day in the morning, one day before lunch, one day before dinner, one day before bedtime. And that can help us to determine. So once you're done with this, like once the thing is done, a lot of them have an ejector. So you don't have to really like prick, you don't have to like really take the needle out by yourself. And if a patient is, if the patient presses the button accidentally, saying like, oh, I loaded I just ejected the needle, you can just pull this thing back and it's going to go again. And a lot of the lancets will have it. And why the pain happens, when we're pricking, is not because of the needle. The pain is happening because the lancing devices actually have a spring, so they're spring loaded. And when somebody's poking, the spring makes the needle vibrate, and that's what breaks the tissue, and that's why people have pain when they, when they inject. A lot of the devices such as AccuCheck Lancet will have a glide. So they have a glide technology. So it's going to glide in without causing the tissue to break, and then it's going to retract itself. So, like these small things can actually help you to, support your patients in choosing the right meter that they need. And a lot of these devices have an ejector. So instead of me like holding it like this and like pricking my finger, and also, needles are biohazard. So if your patient is bringing the blood sugar meter in the clinic, make sure you're telling them to open the lancing device and not you opening the lancing device, because then you become at a risk of, needle stick injury. And in Canada, that's big, because you have to go through like so many tests to be able to, be safe afterwards. So it's not a pleasant thing to have. So after you're done, I'm just going to use this jar, which is not opening for me for some reason. But, and also never, if your patient is checking the sugar and you tell them that, okay, give me your needle, never do like this, because then you're putting yourself at a risk of needle stick injury. Never touch anybody's, biodegradable devices, not degradable, but biohazard devices. I'm just going to eject it on this piece of paper. So you see this one, you just press in the front and the needle is going to come out on its own. So you're not touching it. So the needle directly will go in the sharps container without you having to touch it. Strips can go in the garbage. Needles have to go in the sharps container because it is a biohazard. So that's about glucometers, and how each of them are different, and how each of them are similar from each other. Now let's move on to sensor glucose monitoring device. I'm keeping an eye on the time just to make sure we are on track. So sensor glucose monitoring devices are Freestyle Libre. Freestyle Libre 2 is also out in the market. Medtronic CGM, which is continuous glucose monitor, and Dexcom. I'm going to show you Dexcom CGM, and I'm going to show you Freestyle Libre. So as we know, like blood sugar is checking the sugar from the blood, but let's see what is the difference between blood sugar and the sensor glucose. So I'm going to show you this device. So this is Dexcom G6. So basically, the sensor has a transmitter. So this piece, this is a piece which is reading all the information which the sensor is sensing. So sensor is a small, like a filament. I'm going to show you this on Freestyle Libre. So this is like a small filament. It's like a small hair-like thing. It's made with plastic, not a needle, because a lot of people would think like, oh my God, I'm sticking needle in my body. And the sensor, so the sensor is going to read the sugar, transmitter is going to interpret the sugar, and it's going to send that to receiver, which can be the cell phone or any other device that they're using. So this is where you check the blood sugar from. So from the blood, sugar is going in the interstitial fluid, which is fluid in between the body cells, and the sensor glucose is reading that reading. Now, how is it different between the blood and the sensor? So think of it like a roller coaster. So blood glucose is always ahead of sensor glucose. So when the sugar is stable, then the blood sugar and sensor sugar are almost similar. But when the sugar is going high, your blood will show a higher reading first as compared to a sensor glucose, because remember, the sugar goes in the blood first and then it goes in the sensor. So after meals, generally, if people are checking the sugars after meal, they will find that, oh, the difference between blood glucose and sensor glucose is much more different. It's because the sugars are changing rapidly. And when the sugars are changing rapidly, the sensor is not very good at catching it. So that's why when the sugar is going up, the sensor will catch it later, like it's just following behind. And if the sugars are going low, then so if the sugars are on the downward trend, the blood is going to show first and the sensor is going to show later. Generally, the acceptable difference between sensor and the blood glucose is 1 to 2 millimoles. If it is higher than that, then that means that maybe they need to check it again and they need to verify it more often. And when you're calibrating like these numbers in terms of milligram per deciliter, you will multiply this by 18, and that's what's going to tell you like what's the reading in milligram per deciliter, just for your reference. So sensor glucose and blood glucose are most similar when the sugars are not fluctuating a lot. And when they don't fluctuate a lot is before meals. If you've not had a snack before meals, that's the time we need to also calibrate the sensor. Some sensors require calibration. That means you're pricking the finger, you're putting that number in, the reading, blood sugar reading in, and that's what the sensor is going to read, and it's going to go from there. So, if patients are telling us that, oh, my sensor glucose and blood glucose don't match, this is why. So in terms of reading, having the sensor glucose, there are two types. One is flash glucose monitoring device. So something like Freestyle Libre, which is going to check the sugar when you flash it on the sensor. Benefits of having a Freestyle Libre, I'm going to scan something and I'm going to show you. So that's my Freestyle Libre device. That's my demo sensor. I'm going to check glucose. It's going to tell me what the blood sugar reading is. It's going to also tell me where my sugar is going. And it's also going to tell me what happened before. But when I'm checking my sugar with blood, it's going to tell me only at that time what my sugar reading is. And like we spoke about, patients are more scared about using needles, and, they don't want to. And if they're like with family, or if they have a get together, you don't want to be going to the washroom and checking the blood sugar. Like that's the most unhygienic way of checking the blood sugar. But it's all, having the flash glucose monitoring can just help them to flash it, and it's more convenient for them. You can do it anytime during the day, and also aids in better quality of life. They don't have to think like, oh, I have to take like so many devices with me and things with me. And it also helps in making lifestyle medication adjustment, because you have a lot more information as compared to what you would normally have with just a blood sugar reading. So flash glucose monitoring has its own benefits. And it's also, it's also very useful because it can give us 1,440 values a day, checking the sugar every single minute. But it won't display the reading until it is flashed. That's why it's called flash glucose monitoring. With Freestyle Libre and Freestyle Libre 2, which is a flash glucose monitoring device, you can wear the sensor for 14 days. And then people ask, like, can I shower with this? Can I swim with this? Everybody can do, you can do whatever you want with it. And sometimes when people sweat a lot, this little adhesive, as you know, as you can see, like it's very small adhesive between the sensor and the device. This one is very tiny, so if people are sweating a lot, then they will complain that the adhesive is wearing off very easily, without it using the full 14 days. There are ways around it. There are things that you can use, like skin tack, which is like a tacky, like a tape, not a tape, but it's like a tacky, like just like a tissue, which has a tacky thing. You put that on here around it, around your skin, but not like fully, because you don't want the sensor to come in contact with anything else than the skin. And you can just stick it on easily, and it's water resistant. You can swim with it, you can shower with it, you can do everything with it. And there's Tegaderm that people also can use on this particular device. Just make sure that this is the thing that needs air, it needs oxygen. So this one should always be exposed, never be covered. So tell your patients to make a circle from the Tegaderm, oops, and put it on, and then you can use it. So it's there are ways around making it more tight. Some people also swear by using a deodorant. So you spray the deodorant and you let it dry, and then you put that sensor on. It's going to stick better. So there are ways around it if people are not able to make it last for 14 days. But also these are not like 100% accurate. Like we spoke, like when the sugars are changing rapidly, it's important to not rely on it too much. But if somebody's having a sugar level of less than 4, if they're having any symptoms, feeling of sweating, shakiness, dizziness, they feel lightheaded, they feel they're going to pass out, this one will not show the most accurate reading, because as we spoke, it's lagging behind. And also when people are checking the blood, like, they've had the low blood sugar, they treated the low blood sugar, they want to scan, and then they're scanning, and they're like, my sugar's not going up. Remember, there's a 20 to 30-minute delay between blood sugar reading and sensor glucose reading. So after treating the low blood sugar, make sure patients are checking using finger prick to double check if the sugars went up or not. Don't rely on sensor glucose reading at that time. And if the sensor is not showing a number or an arrow, that means something's not going right. Make sure you check your sugar with a blood sugar reading. Also, the sensor readings are not very accurate on day one of putting it on, because your body's like, oh, there's something foreign inside me, like I'm gonna react to it. So then the sensor readings are generally higher on first day as compared to the rest of the days, and as body gets used to it, the sensor readings get more and more accurate. So Freestyle Libre and Freestyle Libre 2 are the new flash glucose monitoring system. Freestyle Libre has been out for a long time, but Freestyle Libre 2 has just been launched. Freestyle Libre can be used with reader or app. So basically you can have a cell phone and you can have all the readings on it. And when you're scanning, you scan with the back part of the cell phone, and it uses app called Freestyle Libre Link. Freestyle Libre does not have any alerts, but Freestyle Libre 2 has customizable alerts. So even when you're not scanning, the patient will be notified about any high blood sugar reading that they put in the reader or in the system, or like any lows, any signal loss. They're going to get alerted for it. And these are all customizable. You can choose to leave them on, you can choose to leave them off, and you can choose to keep them on whatever number you want to keep them, whatever you feel safe is the number. And also, Freestyle Libre uses Freestyle Libre 2. The readers are not available yet for Freestyle Libre 2, but they are going to be available shortly. And Freestyle Libre Link Up is the app that you use with Freestyle Libre, and Link Up will actually help people to have data sharing with up to 20 people. So if it's a child, for example, living with type 1 diabetes, the parents want to know what the sugar reading is, and how things are going, so they can share the app. Or if it's a husband and wife, so husband maybe he's a truck driver, he's going out, or he's like working, and the wife would want to know, then they can share the data just so that they feel at peace. Also, people can share data sharing with healthcare providers using Libre 2. So if they're using a meter, they need a yellow cable that comes with it, and it's a micro USB, and this one also needs to be charged. So make sure you tell the patients, because they don't have a battery. A lot of new devices don't have any batteries in them anymore. And if they're using an app, they can automatically upload. And each clinic can have its own like clinic ID, just like we spoke about having a clinic ID for One Touch Reveal. And and you can share the data. And whenever you call in the patient, you see a lot of information like AGP. Like that can be a totally different presentation, like how to understand and interpret AGP, which is ambulatory glucose profile, and how do how to interpret the data that you can see in the Freestyle Libre report, because it's a lot of information. Like how do you use a correct information? Like that's important. So that's about Freestyle, Freestyle Libre. CGM, I'm not going to cover this in a whole lot of detail because there's a lot of information for this one. But I'm still going to introduce it to you. So there are two types of CGMs, or continuous glucose monitors, that are available in Canada. This one is Medtronic CGM, and this one is Dexcom G6, which is a most recent one. So CGM, as we spoke, has three components. This is a sensor. So this part is a sensor. If you can see, this part is a transmitter. This is a brain, and there's a receiver. So people can have the reading sent on the cell phone or on their Apple Watch or Samsung Watch, or if they choose to have a Dexcom reader, they can have that. But usually a lot of people prefer to have it sent on the phone. It also reads the sugar every 5 minutes, and it sends it to the receiver. So you know how flash glucose monitoring requires readings to be flashed. Unless you scan it, you won't know. This one will display continuously on the reader, and it's the same way. Like it's going to show, as you can see here, it's going to show what the reading is, where it is going, and what happened previously. And also they have they have data sharing compatibility. So Dexcom uses Dexcom Share, which is you can share data with 5 people, up to 5 people, and it just gives you peace of mind. It has alerts and alarms, just like Freestyle Libre 2, and it has 7 to 10 day wear, depending on the brand. So Medtronic has up to 7 days of wear. Dexcom has 10 days guaranteed wear, and if the sensor falls off within 10 days of of use, Dexcom will you call Dexcom, and Dexcom will repair, it will replace it for you, no questions asked. So that's a good thing about Dexcom. And also, as in Freestyle Libre, also Freestyle Libre and Dexcom, the sensor glucose reading can be used for treatment decisions. So for somebody who's using insulin and they want to determine the dosing of insulin based on the sensor glucose reading, you can do so because it's approved. With Medtronic, you cannot do that because you have to make sure you have a finger prick, and Medtronic needs calibration. So this guy needs calibration, this one. So at least 4 times in a day. So it's going to read the correct readings for you. And also you can find more information on the company website, because there's a lot of information about this product, and it's a lot, like it can be overwhelming in one session. So, if you want to have another session, we can have another session about that. But there are like healthcare provider videos, patient education videos, and how to use them and stuff like that. One thing that I will tell you is Freestyle Libre, you put it at the back of the arm. That's where it is approved. Cannot put it anywhere else. Dexcom has been approved for use on the arm as well as on the abdomen. So if you're using it on the abdomen, put it like this. If you use it on the arm, put it like this or like this. So based on how the bodies go, like, the alignment of the body. So our hands are aligned like this, we put on like this. Our belly is aligned like this, we put it like this. And make sure it is 3 inches away from the injection site. So if you have a patient who uses an insulin pump, or if you have a patient who uses insulin injections, make sure you tell them to not inject insulin in 3 inches of their CGM. Otherwise, it's going to interfere with the data. So how much do these things cost? Because these are expensive products, right? So average cost of FGM, Freestyle Libre is 99%. So this is the lowest amount, but every pharmacy you go to will have its own. Shoppers is the highest at 120%. So, and Reader is 59 per year. And also Reader, you cannot update. Apps are updated from time to time. So apps are more accurate in reading the data as compared to using the Reader. So it's about $2,500 a year. A lot of the insurance companies will cover, the insurance cost for these particular products because it's cheaper for them. And insurance companies will not cover, like we cover Dexcom, we don't cover Freestyle Libre. Insurance companies cover CGMs in general. So it doesn't matter what brand you take, it's a preference again, because Dexcom, you don't need to calibrate. Freestyle Libre, again, less accuracy issues. With Dexcom, you don't have that. And Medtronic, you have to calibrate. Average cost of CGM, Dexcom, is $299 for a pack of 3. So because it's used every 10 days, that's why you get a pack of 3 per month. And it's about $4,700 a year. So it's much more higher than, Freestyle Libre, but it's more accurate, and it's like it can be beneficial if you have a patient who's using an insulin pump. Some of the pumps will communicate with Dexcom G6, so the pump can adjust the basal rate, or give a correction bolus based on the Dexcom reading. So the patient has to do less work. So depending on the patient preference as well. And Medtronic Guardian is a pack of 5, because as we spoke, it lasts for 6 to 7 days. And this is like this is like double the cost for, than Freestyle Libre, but there are subscription plans available which are more cost effective. So if you were to, like, if a patient was to, subscribe to Dexcom G6, it would be around $3,000, $3,300 something per year. So in terms of Ontario coverage, so Freestyle Libre is covered by Trillium Drug Benefit and ODB, which is Ontario Drug Benefit Program for people over 65. Dexcom's not covered. Freestyle Libre 2 is not covered. Freestyle Libre 2, they've actually applied for coverage, but they've not heard anything because, as you know, COVID's going on, everybody's slow, and sometimes it can take forever with the government to approve things. So Freestyle Libre 2, Dexcom, and Medtronic are not covered, but a lot of insurance companies will cover it. And also, Dexcom and any CGMs have, they have medical necessity form. So if your patient is interested in it, you can say medically this patient needs it because he it can help him to achieve optimal glucose control, or somebody has nocturnal hypoglycemia, like nighttime low blood sugar, or fear of low blood sugar, hypoglycemia unawareness. Like those are the things that you can mention if you want to advocate for your patient, because at the end of the day, we all here for patient care, and we have to stand up for our patients, and sometimes we just have to stand by them, stand with them, and let them get what is safest thing for them to do. So if you want to know more about blood sugar monitoring, this is where you go. So Diabetes Canada has a frequency of SMBG tool. So it's like a list of questions that they will ask, and it's gonna guide you in terms of like how many times should this patient be checking the blood sugars based on the information you put in. And also Diabetes Canada also has a webinar on interpreting and accessing CGM reports. This is a very good webinar. I would highly recommend if you want to understand reading AGP reports. And also, Meter FGM company website, like know your reps, like who your reps are for Essentia, who's your rep for Abbott, because these are the guys who will give you all the information, like not just like basic knowledge, but any changes that are coming, like they will keep on updating you. And it's important to make sure that you have a great relationship with them, because they are the ones who are giving you like all the inside information. Like sometimes like my reps will tell me and like, don't tell them I told you this. I'm like, yeah, I won't, because a lot of patients ask, and we have to make sure we're communicating the right thing to them. So we're right on dot. So takeaway messages are working with clients' preferences, abilities, limitations, challenges, providing relevant information, because it's like if healthcare provider is not comfortable with a particular thing, they will not recommend. So it's important that we have all the relevant information that we need, and we are providing them with the freedom to choose the correct glucose monitoring device that works with them and their lifestyle, and encouraging self-management. So our job as healthcare providers is to encourage them to to manage their diabetes in their own possible way, and to give them the tools that they need, because we are only there with them for a short period of time. When they know how to manage it on their own, it's easier for you as well as for them. And knowledge is power. So make sure you know about the products and you have the knowledge, then you can support the clients in the best possible way. So that's it from me. We're right on dot. So if you have any questions, I'm here for you. I'm able to answer them for you. One tip which I will give you is how to interpret. If a patient is giving you a logbook, how do you interpret it? Look for patterns. So if the sugar reading is high 3 days in a row, above target 3 days in a row at a particular time, that's a pattern. If the sugar is low 2 days in a row, that's a pattern at the same time. So I'm going to open the floor for questions, and if anything you have, I'm happy to answer for you. Or if you have any experiences that you want to share, always happy to listen to them.
Thank you, Arpita, for all of the valuable information you've shared with us today. So as Arpita said, everyone, please share your questions in the chat box. I will read them out and Arpita will answer them to the best of her abilities. Just in case, if due to time we are not able to answer all of your questions, we will send you an email with the answer of your questions to make sure that you are getting the right answers. So don't worry, all of your questions will definitely be answered, whether it's right now through the webinar or through email later on. Other than that, just wrapping up, thank you so much. If you guys would like to learn more about diabetes, as Arpita mentioned, Diabetes Canada has some great webinars as well. And IDNC also offers a diabetes educator course, which covers a vast number of topics based on the 2018 Diabetes Canada Clinical Practice Guidelines. And you can find more information about this course at courses.idnc.ca. So you can find this link in the chat as well. Make sure to check that out, and I'm sure it'll definitely be of interest to all of you. So we can get to the questions now. The first question we have is, are flash sensors recommended for non-insulin dependent patients?
So that's a great question. Thank you, Sophia, for asking that. So it's definitely recommended for any, any patient, that it might benefit. However, it's not covered for those kind of patients. Like provincial coverage is only for people who are using insulin. So if they're not using insulin, then the province will not approve it. However, if it's a personal choice, and if they have private coverage, then definitely it's going to be covered.
Awesome. Any other questions we can answer today?
No problem, Sophia. It's nice to see you. Read your name. I can't see you, but it's nice to read your name. No problem. Any other questions? Sometimes I get scared if there are no questions, because it's like either everything was understood or everything was like, shh, couldn't understand.
First thing, everything was understood.
Okay, great. Thank you. Thank you, ma'am.
Clear, to the point, everything excellent. Thank you.
Thank you, ma'am.
Okay, we have another question. So Tuba is asking, are these sensors used in GDM patients as well?
Yes, so Dexcom G6 has been approved temporarily during the pandemic to be used in GDM patients. Generally, sensors are not, not approved for pregnancy, because pregnancy targets are very tight. Normally, if somebody is not pregnant, the goal is to keep the sugar between 4 and 7. And when somebody's pregnant, the goal is to keep the sugar between 4 and 5.3, because the sugar is so tight. And the sensor is not very accurate. That's why we don't generally recommend for pregnancy, but temporarily they have been approved for GDM.
Okay, so next question. Harsheen is asking, what if the patient has other comorbidities like liver diseases?
So you mean can the sensor be used for people who have liver diseases? Is that what you want to ask? Okay. So, having the sensor is gonna, remove one thing from the list of things that they have to do. So if it helps in enhancing the quality of life, for sure, but it's important to make sure we educate the patients in regards to when should they check the blood sugars, what is the time that they should be checking the sugars to verify. Although I will say that the sensors have not been tested for people who have renal diseases. Not sure about liver diseases, but it's not been tested for people having renal disease. So it's not that they cannot use it, but but it's just it's not being tested. So you just have to make sure you use it with caution.
So Millie has another question. She is asking, is it due to tight targets in GDM that sensors are not valid, or the effect of hormones during pregnancy can influence the BG readings in pregnancy?
Yeah, so it could be both. So it's a target. The targets are tight because you want to achieve a tighter control so that the pregnancy is going properly and the sugar can pass. And if the sugars are high in the first trimester, sugars can pass through placenta and reach the baby. First trimester, it can cause abnormalities. Second and third trimester, if the sugars are high, it can cause it can cause the baby to grow bigger and preterm delivery and stuff like that. So it's a mix of both. So the sugars are high, the targets are tight because of because of insulin resistance. The hormones are being made which make the body insulin resistance, and that's why the sugars go high. So it's actually both that play a role in terms of approval for sensors in pregnancy. But again, in pregnancy, because the targets are so tight, they're so precise, and the dosing can depend on that number. You want to make sure that whatever you're basing the insulin dosing on is accurate. And that's why, like with pregnancy, we monitor them every single week if they're on insulin. If they're not on insulin, they're still monitored every 2 weeks. So to answer, yes, it can be both, Millie. Thank you for asking that question. It's a very valid question.
Awesome. So any other questions that we can pop in quickly in the next few minutes, feel free to leave them in the chat. Other than that, if you guys want to share any other personal experiences related to diabetes, like Arpita said, you can feel free to turn your cameras on, or if you want to just turn on your mic and share a quick story, that's totally fine too.
I'll tell you one story. So I had a client, nobody wants to ask, so I'm going to share. I love to talk. So I had a client in my office one day. The endo was bringing this client to me. This is before pandemic happened. And he's like, Arpita, can you start him on insulin? So I said, sure, no problem. We work on a medical directive, so we can start people on insulin. So I'm speaking with this guy and I'm asking him, Mr. X, do you check your blood sugars? He said, no. And I'm like, okay, do you mind if I check your blood sugars? That time we were allowed to go closer to people. So I'm checking his blood sugar and I'm finding his sugars at 28. And I'm like, and the sugar should be less than 7 for fasting, less than 10 for 2 hours after eating. So I'm asking this guy and I'm like, do you feel any symptoms? He's like, no, I feel fine. So generally for people like that, if the sugars have been high for a long period of time, they lose the feeling of having high blood sugar. So people don't feel thirsty, they don't feel weak and stuff like that. Body gets adjusted to it. So when somebody is having high sugars, you want to make sure that you're bringing the sugars down slowly. And that was a teaching point for me to teach him that, hey, it's important to check your blood sugar because you could have been in ER by now. Like it would have been so dangerous. So like sometimes people don't understand the importance of checking the blood sugar, but things like that can actually help. And if you share your experiences or any other clients' experiences with the other clients, that can actually help them to relate to people, because you don't want to make them feel that they're the only ones in this world who are checking the blood sugar, or they're the only ones in this world who are having diabetes. Because diabetes is not just diabetes, right? It doesn't come. Anybody who's living with diabetes does not just live with diabetes. They have like so many other things, plus the burden of living with diabetes. Like every single day you want to take vacation from work, you can take vacation. If you want to take vacation from diabetes, you cannot take vacation from diabetes. So it's important for us as healthcare providers to be standing with our patients, to be there with them, if they need that extra support. So having the knowledge is one of the biggest thing, and they rely on us for knowledge. So yeah, that's my story.
Arpita, I would just like to share in general, not a particular case. In spite of knowing everything, still here what we come across overall, people are not taking it seriously. I don't know how to convince. Like, I'll give you an example of, I had a 3-day workshop of a corporate on Wednesday, Thursday, Friday. I just finished yesterday. So there were 25 couples. Okay, online personal data collection I was doing. I think leaving aside maybe just couple of them, all others diabetic, all. And very nicely they are saying, yeah, diabetic since 15 years, 17 years, control mein hai. Like, I was like, why? What is it that is not allowing them to, take action?
I think
I mean,
like,
I'm just telling you, asking from your
yeah, like
experience.
I work in Brampton. So Brampton is like mini Punjab. You see like all South Asian people. And if you live in Brampton, you have to know Punjabi. So I'm not Punjabi, but I can still speak Punjabi language. So, for those, Baba ji and Bibi ji, they will be like, Hanji, मैं कर दिया check, पर कोई नहीं कदी कदी बढ़ जाती है. Like sometimes it goes up.
Correct,
But I'm
correct.
like, it's because they normalize that thing. They're like, oh yeah, it's okay. Sugar badega, we will take medicine. We're gonna be fine. If the sugar goes up, I'm just gonna take medicine and I'm just gonna be fine. Just because
Exactly.
I
So
think,
I feel, terrible. You continue, but this is what I wanted to tell you, that we are trying our best to educate you maximum. I'm also, as per India, I'm also a certified diabetes educator and dietitian also. Sorry. So continue.
you're big,
So
ma'am. I know you. So
oh, really?
yeah.
Okay.
So
Okay. Okay.
it's more about like creating that awareness, and we can only do so much. We cannot go to
That
their
is
homes
what.
and we cannot monitor what they're doing. We all make a change when it is meaningful for us. So our goal is to keep them safe. Like if I have young patients who I follow, like 17, 18, 19 years old, and you know how teenagers are. Like so then these guys, we just have to make sure we keep them safe. Like we teach them how to manage the low blood sugar, how to manage high blood sugar, and how do we keep them safe. It's our goals may not match their goals. We cannot, like, my goal is to make sure this person is having optimal sugars every day, but that may not be what they want, right? So it's important, as long as we're keeping them safe. I think that's the only thing that we can do as healthcare
So
providers.
I can just share with you, if I have to tell you one story. My own first cousin's wife, 20 years back, I was working in Hinduja at that time. She came with 800 blood sugar just suddenly, and simultaneously detected ovarian, bladder, and uterus cancer. So uterus removed, bladder removed, ovaries removed. After going through that, even till today, our madam doesn't. One day she lands up in Hinduja casualty, midnight, 27 blood sugar. 27. Then I get a call. But she's just not. Like, God will take care.
Ma'am, like sometimes maybe people are in denial. Like they have so much going on. They don't want to accept, and they just want to like live their life. Like, I want to live my life the way I want. I want to live it on my own terms. And sometimes it's just that. And I think like all we can do for those people is to provide them with support. Like, okay, this is what you do.
I
This is
only
how
do
I'm
that.
here for you. And that's all we can do, ma'am. We cannot do
But
anything
that only.
more
I
than
thought
that.
if there is any other Ramban Ilaj, how we say, na,
We
for
cannot
such
do
people.
Ramban Ilaj, ma'am. We have to, like, end of the day, we have to be there for them. That is all we can do. Like
That we
that's
are
all,
there. We are
yeah.
there.
But that's all we can do, ma'am.
Okay, okay.
Thank
Thank
you
you.
so
Sorry,
much,
sorry.
Arpita. And thank you everyone for attending this webinar. Really appreciate it. And Noor, if you would like to close the session.
Yeah, for sure. So again, thank you so much for all the valuable information you've shared with us today. It was definitely an honor to be learning from you today. If you all enjoyed this webinar, please feel free to join our upcoming webinar as well. That is also in collaboration with LMC Healthcare. Again, so at Dietitians Network of Canada, we are here to help everyone throughout their dietetic journey, whether it's in Canada, US, India, everywhere else around the world. So please, again, feel free to join our upcoming webinar. And if you have any other questions that we might have missed, or that something that comes up later, send us an email at info@iednc.ca, and we will definitely pass it on to Arpita and she can answer it. But once again, thank you so much, and it was a pleasure. Thank you. Bye-bye.
Thanks a lot. Bye, everyone.